Hello, today we will see what is myocardial infarction. The myocardial infarction is the blockage of blood flow to the heart muscles. It causes loss of oxygen in the myocardial cells and it dies or necrosis is happening. Now let us see what are the causes of myocardial infarction. The main cause is blockage of coronary artery. Coronary artery is the artery which supplies the myocardial cells. So how this coronary artery can be blocked? There will be atherosclerosis or fat deposition in the arteries. Another one is thrombus formation. Thrombus formation is nothing but the accumulation of blood cells near the fat deposition. So in these two conditions, the narrowing of blood vessel will happen or the blood supplied to the myocardium will be very low. There will be complete blockage or sometimes narrowing of blood vessel can happen. Another condition is CAD. CAD is the coronary artery disease. This is another way of narrowing of the arteries. Another cause is coronary spasm. This is mostly drug induced coronary spasm. The drugs like cocaine are responsible for the coronary spasm. And sometimes damage of the artery can also happen. It could be a physical damage or rupture. Now let us see the risk factors. They are hypertension, diabetes, obesity, physical inactivity, stress, alcohol consumption, smoking and increased cholesterol level, especially increased LDL. Now let us see the pathophysiology. Here this is the aorta which supplies the myocardium with a right coronary artery and left coronary artery. These two are the branches of aorta and it supplies the myocardium. Now from the aorta through the right and left coronary artery the blood enters into the myocardium. So here the right coronary artery which lies on the right atria and right ventricles. So when there is any obstruction in this right coronary artery, there will be inferior wall myocardial infarction can happen. And its another branch is right marginal artery that will supply the right ventricle and the septum. And one more branch is there as posterior descending artery which supply some parts of the septum. And here we have left coronary artery. It has two main branches, that is left circumflex artery and the left anterior descending artery. The left circumflex artery supplies left atrium and left ventricle. When there is any obstruction in left circumflex artery, it will show in ECG as inferior wall MI and posterior wall MI. Now let us see the left anterior descending artery. This is called as LAD. It supplies right ventricle, left ventricle and the septum. This is an important artery which, so if there is any obstruction in this LAD, it causes more damage to the body because the left ventricle supplies blood to all over the body. So it will be seen in ECG as AWMI, that is anterior wall MI. Now let us see the symptoms of myocardial infarction. Mostly the patient will experience heavy chest pain, that is called as substernal crushing pain. The pain will be radiating to neck, hand, jaw, back and shoulders. This pain will be mostly sustains more than 30 minutes. So in angina pectoris the pain will subside within 15 to 20 minutes. And in this case the patient will experience nausea, vomiting, diaphoresis, anxiety. Sometimes patient will have increased BP and increased heart rate also. The patient will also experience SOB and this pain will not subside with rest or NTG. NTG is nothing but nitroglycerin. So mostly in angina the pain will subside with nitroglycerin. Now let us see the diagnostic evaluation. The troponin I is the most accurate diagnostic evaluation because it is secreted by the myocardium when it is damaged or there is a death of myocardial cells. So it will be secreted within 3 hours and it may last for 7 days. So The elevated troponin I will be clearly indicate there is a damage in the myocardial cells. And the another blood test is CKMB. So it is also elevated in the case of myocardial infarction, but it is elevated after 18 hours of any damage to the myocardial cells. And next one is myoglobin. Myoglobin test is the early marker because it is secreted within 1 to 2 hours. But it is not considered as a relevant examination because it is secreted by some other muscles also. Next is echocardiogram, ECG and the stress test. And mainly we can go for angiogram. So here we can identify the exact place and where the obstruction is present and we can remove by angioplasty. Finally, let us see the management of myocardial infarction. The pain will be very high in myocardial infarction. So the opioid analgesics like morphine sulfate, the patient will experience SOB or shortness of breath. The oxygen administration is necessary. The drugs like antiplatelets, thrombolytic agents and beta blockers can be administered as per the doctor's advice. If there is arrhythmia, antiarrhythmic agents will administer. And the exact management is angioplasty or PTCA, percutaneous transluminal coronary angioplasty. So if there is any clot, we can remove the clots and place a stent through angioplasty. The surgical management is CABG, that is coronary artery bypass grafting. In myocardial infarction, we will have the complications like arrhythmias, pulmonary edema and heart failure. I hope you understand this video. If you like the video, please like, share and comment. Also, please don't forget to subscribe and press the bell button. Thank you.